Good morning, everyone. A very warm welcome to all the viewers for the fourth lecture of the lecture series hosted by One Play Sports in association with Aquacentric Therapy. Having worked closely with various sports persons, our expert team of physiotherapists have extensive experience in sports physiotherapy. The speaker for today is Dr. Nikita Vaidya. She has done her master's in musculoskeletal physiotherapy. She has a certificate in manual therapy and in clinical neurodynamics. She has worked as an on-field physiotherapist for Khelo India 2019, Pune International Marathon, and Oxfam Trail Walk. She is also a certified aquatic therapist. I welcome Dr. Nikita Vaidya to begin her talk.
Um, Thank you, Dr. Devashri. So I welcome you all for this fourth lecture on common injuries in cricket. And I would also like to welcome our special guest for today, Mr. Anubhav Jain, who's on panel with us. And Anubhav Jain is the principal presenter at sports-focused media startup called One Play Sports. Outside of work hours, Anubhav likes to spend either watching cricket and football, and he's an industrial engineer by profession. We welcome you, sir.
Thank you so
Uh,
much.
So today we'll be talking about common injuries in cricket. I'll be talking a brief about biomechanical aspect of it. Then we'll be talking about the injuries. And lastly, we'll be talking about how aquatic therapy is a boon to rehabilitation and the importance of aquatic and a holistic rehabilitation approach. So I'll start with the presentation now. So let's now see the common injuries in cricket. As we all know, cricket is a global traditional sport, most popular now, played across 105 member countries of ICC, and it is the second most popularly viewed sport after football. So, cricket has captivated interest across all the age groups, across various background, various abilities, and now is a keen interest due to increased commercialization and importance given to this sports now. It involves, it's basically a complex game involving a lot of physical fitness, agility, skills, and strategy. So, as I said, the advancement and commercialization of the sport has led to importance in performance enhancement. Hence, the injury prevention strategies have gained importance both at your recreational as well as your professional level. So, establishing the extent of injuries is now considered the first step towards this prevention and management. Now, when I talk about injuries, cricket is a repetitive nature of sport, involves a lot of quick movements, lot of jumping, diving, strides, different change of stances, involves a lot of physical competency, and hence it's prone to a lot of repetitive injuries and traumatic injuries. Now, even the incidence is more or less the same. The prevalence of these injuries has increased greatly due to the more number of matches played and shorter rest period in between. So, bowling has the highest prevalence of injuries, followed by your fielding and wicket keeping, and then the batting. Now, diving deeper into the prevalence, you can see that lower limb injuries. So, even if you feel that yes, cricket involves a lot of your upper limb movements, lower limb injuries account for a good chunk of 50%, followed by your back, upper limb, and neck. Now, because of advent of advanced protective gears, the head neck facial injuries, the prevalence of these injuries has greatly reduced, however, not yet gone. After we understood a more of prevalence, let's just dive a little into the basic biomechanical aspects of how the game looks like. All right. So when I talk about bowling, the basic run up will be same. The overhead movements are seen both in your fast bowlers and spinners. However, in bowlers, you see a run up. Now, run up and pre-delivery stride is basically to gain the velocity for your throw. Then comes your delivery stance. So, delivery stride is something now when your front foot is going to contact the ground. So, this is the most important phase considering the fact that when your front foot is touching the ground, approximately 9 times of the bowler's body weight is imposed on that leg. So, correct biomechanical aspect here again plays an important role. So, when you have a proper delivery stride with your front leg extended, that is where you're able to produce a good speed. Then comes the phase of ball release. Now, this is a very important phase because if things go wrong in this phase, whatever efforts we took in the previous phases are going to go waste. So, here, usually bowlers they extend your wrist first and then flex it for a better or a faster ball. And you have in swing, out swing both. However, the biomechanics more or less changes a bit according to the type of bowling. However, the post generation strategies remains the same. Then comes your follow through phase. Now, follow through phase, if done correctly, it will avoid a greater damage. So, if the bowler is in a lot of velocity and suddenly comes to a stop, that's going to hamper something. So, follow through is gradually tapering down the force that he's generated before. So, if done correctly, avoiding the damage there. If you can see, whatever is turning red here are all your muscles that are getting activated during the phase of bowling. So your quadriceps, calf, and your core muscles especially are highly active when you're doing the bowling movement. You gain a lot of energy from the lower segments and translate it into the upper one. Talking about batting, now I pause it. So if you can see that before taking a stance, the research has said that a good static balance at the beginning, a dynamic balance throughout the activation of batting, throughout the stride is very important for an effective delivery. So, right, so your base should be stable, your base should be supportive and controlled, and only then is your upper limb velocity generated well. So, when you see in bowling, in batting, now, in batting, if you just see in all the phases of your batting, especially your core muscles, again, what is turning red over here is something that is activated throughout. So, if you see that the core muscles are constantly getting activated in all the phases of batting, core is an important segment that is going to translate, that is going to take your force from your lower extremity and translate it into your upper extremity. So, middle segment is really important to absorb the forces. Now, let's just see what are the common injuries. Um, so, fast bowlers, especially your fast bowlers, they have a lot of overhead throwing movements. So prone to a lot of repetitive injuries. Also, the back injuries, the back strains because of alternative contraction of the muscles, especially on a non-bowling side. Then your knee and ankle injuries seen in your bowlers. We'll see how the injuries actually happen. Coming to batting, now batting involves a lot of maintenance of a constant stance, a lot of weight shifts, a lot of deliveries, a lot of stride, which imposes a lot of weight on your hip joints. So, groin pain is one of the most difficult injuries to manage in cricketers, batsmen, followed by your back, your thorax, and upper limb injuries. Now, wicket keepers are required to maintain again a sustained stance. They are required to do a lot of weight shifts. They need a lot of quick reflexes, and they again are subjected to a lot of traumatic injuries with ball directly hitting the fingers and overuse injuries of back and maybe a traumatic injury of an ankle, most commonly seen in wicket keepers. Now, what are the risk factors that will increase your chances towards these injuries? What I mean by improper warm up and cool down is a proper justice about the timing should be given to both your warm up and your cool down. So I lift up a dumbbell and that's not how it's done. A good justified time and a good justified exercise regimen for your warm up and cool down is required. Overtired practice, as I said, a long durations of play with less interval for recovery and rest is again one of an important factor of your risk of your injuries. make you prone for your injuries. Talking about inadequate technique, as I mentioned previously, a correct stance, good balance, good muscle control, good biomechanics prevent you from this injury. Inadequate technique is going to make you prone to those. Previous injuries, any history of previous injuries has to be respected. That much time has to be given for healing, and a good rehabilitation has to be done. Only then you can give a green signal towards the person returning to sports. So these are basically some risk factors that make you prone towards injury. Now let's just dive into the injuries. Talking about craniofacial injuries, what I mean by craniofacial is mainly your head neck region. So previously we all know that there was a concept of bodyline bowling. So that is where the players were a lot prone, a lot impacted because of injuries, especially to their trunk, especially to the head, and those were the career destroying injuries for cricketer. However, after the advent of your protective gears, the incidence of these injuries have lessened. It has in fact grossly lessened, not yet completely gone. So I'll show you some examples of traumatic head neck facial injuries there. In spite of protective gear, there you go, a massive blow to the scalp. Um, the prevalence, I would say, has decreased from over 62% to 4% over a period of 2 years after the advent of protective gears. However, the recent fatal accident that had taken place again raised the queries on the designs of helmet and rule modifications. So, protective helmets definitely have protection against your catastrophic injuries, but not yet proven against the head concussions. Also, our wicket keepers are highly prone to head neck facial injuries. We know that few cricketers, the bales of the stump had directly hit the eye, again disturbing the career of the cricketer, and that's how it is. Shoulder injuries. When I talk about shoulder injuries, usually your traumatic shoulder injuries are seen in fielders, especially, and then comes your overuse injury. So we'll just quickly see that what I mean by traumatic injury. It's a sudden impact to the shoulder, especially in fielder. Now there, if you see, he landed up in the most stable position of external rotation, abduction, and has gotten his shoulder dislocated. Now so this was an example of a traumatic injury. However, your fielders, especially your close-in fielders and your bowlers, have a lot of repetitive overhead movement, especially your throwing activity has a whip-like action, and a lot of abnormal torque is generated around the shoulder joint. And that is why, because of repetitive nature, these are the muscles of shoulder joint that are constantly getting friction upon the bony arc if the cushion, that is bursa, is degenerated. So 63% of fielders and 35% of the bowlers in a study have represented a negative impact of these overuse injuries on their performance. Talking about elbow, so usually because of again, elbow pain comes in the domain of overuse injury. So because of your repetitive wrist movement and repetitive movement of your gripping, there's an extensor muscle origin right from your elbow. So that I'm doing this, there's a lot of irritation that has been taking place over here, and the irritation that is rubbing off your ECRB, there's an extensor tendon on the bone, leads to a lot of inflammation and pain. So it hampers your functional activities, rightly called as lateral epicondylitis or tennis elbow. We all know that the god of cricket himself, he had, and apart from medical fraternity, of course, the world came to know what is tennis elbow after that. So if detected early, it can be managed by conservative treatment and good rehabilitation. However, if it impedes your functional activity to a larger extent, your performance to a larger extent, it goes towards surgery. So Sachin Tendulkar had undergone surgery for the same. However, with a good rehabilitation of 4 months, he was back on field. Hand injuries, usually, yeah, one more thing I would like to mention in shoulder injuries is the span of days that are lost in overuse injuries is significant because of the pain and swelling. Even here, the span that is lost is too much. So that is what is a worry when it comes to performance. Hand injuries specifically are what's seen is your traumatic injuries and especially fractures to your last two fingers. Then your mallet fingers and all is less common, but traumatic injury in batsmen, especially to your last two fingers, is commonly seen. And so in cricket, it varies. The prevalence of your hand injuries varies from approximately 11 to 13%. And if managed conservatively, the mean lost days is across 27. If it goes to surgery, it might go till 50. Trunk strain. Now, if you this is especially seen in bowlers on the non-bowling side. So in the non-bowling side, you have an alternate lengthening, contracting, and again lengthening of the trunk muscles, causing a lot of irritation over the side trunk. So the muscles get strained, muscles irritate over the bones, and that is one of the most painful apart from your hip region. So trunk strain is a lot of pain there, but however, good rehabilitation and you're good to go. So your vertebrae in normal anatomy have a cushion-like structure present in between them that absorbs a lot of shock. So it is a good shock absorption mechanism. However, if abnormal forces have been impeded upon it, slowly it leads to degeneration of the disc, reducing its force absorption capacity, slowly leading to something called as degenerative changes of the spine. And if it progresses, it might also lead to a stress fracture of vertebrae called as spondylolysis. Progressing further, it might lead to translation of one segment over the other called as listhesis. So you have something called as core muscles that surround your joint very well, surround your vertebrae very well. And core muscles can absorb a good amount of force. So don't worry, if you have a good core, if you have a good biomechanics, you're good to go. Hamstring injuries are most commonly seen injuries, and so a seasonal incidence of approximately 8 to 7 injuries per 100 players per season is seen, and so it is often related to increased number of overs bowled in previous week. So that's a study that has been shown. Now, hamstring injury has something called as modifiable risk factors toward it and non-modifiable. So modifiable is your inadequate strength, inadequate flexibility, fatigue, inadequate warm-up, then a history of low back injury, previous injury, strength imbalance between your hamstrings and quadriceps. Then you have your non-modifiable factors like your age or previous history of previous injuries. There's also one study that has said that your lumbar muscle, your lower limb muscle strain have a correlation with your lumbar stress fractures. Knee injuries, usually traumatic injuries are seen in fielders. Now you will see him landing, the fielder landing on a flexed knee and his knees. So usually your ligament injuries, meniscal injuries are your traumatic injuries of the knee. Apart from that, you have something called as overuse injuries in the knee also. So a lot of irritation of your quadriceps tendon, degeneration of your patella fat pad leads to patella tendinitis, again a painful condition. Progressing, for example, there are a lot of abnormal forces with weak muscle and lack of flexibility impending on your knee. Your cushion-like structure called meniscus in the knee starts getting degenerated. Then the forces slowly come on your bone and they start getting eroded. Ankle injuries are commonly seen in wicket keepers and fielders. A sudden traumatic twist of your ankle while catching, also seen in wicket keepers while changing the stance or maybe catching the ball and doing a wider stance and a disorganization of the stability. So specifically, traumatic injuries are seen in ankle. So these are the highlights of the injuries that we saw, and these have gained a lot of importance because these injuries were said to also disturb the career, disturb the performance, and are now termed as cricket injuries from 2016. Now, after talking about the injuries, let us just talk about the prevention and management and what exactly do I mean by a holistic rehabilitation approach. So prevention is something that happens before the injury has happened. Again, it requires a lot of emphasis on your technique correction, on your performance enhancement, a good biomechanics, adequate warming up and cooling down. Your rehabilitation experts, your physiotherapists must prioritize the strength and endurance of the muscle. They should respect the injury. What I mean by that is every tissue in our body, be it a ligament, be it a bone, be it a tendon, has its own specified time frame of healing, and it has its own phases of healing, and those phases have to be respected. Your treatment has to be in line with those healing phases because that is physiological and that is anatomical. Proper justice should be given to rehabilitation. Don't be in a hurry to go back to sports. Finish your rehabilitation, get a green go, and then you're good to go. Management is something that I'm going to do after the injury has happened. So holistic rehabilitation will come, we'll see what it is in the coming slides. Functional training, whatever rehabilitation I'm doing has to be ultimately translated into the function that the person is supposed to do. So your functional recovery and functional training should be your goal setting right from day one. Sport specific training is translating the effects of your attained strength into your sport that is designed, the athlete is designed to play. Then incorporation of your neuromuscular training. Remember, your postural reflexes, your motor control, targeting your nervous system right from the first day of rehabilitation is the first factor to prevent the recurrence of the injury. Assessment and reassessment has to be there. Now, quick on-field assessment. What I mean by that is um, be very responsible when you are there on field. So you quickly need to assess whether it's a fracture, it's a dislocation, or it's a soft tissue injury. Take a wise call. Arrangements have to be made for medical services. Just because you got that tape, don't go and take that without an assessment. Respect the injury, and if you feel that the athlete cannot play, make sure that you tell him that, listen, this is what you need to do. Your life matters more, so please come out with. Also need to respect whether it's the starting of the season or end of the season. Your on-field management slightly varies there. Now, let's see what is aquatic therapy. So water does wonders. So aquatic therapy is basically using water, uh, a medium of water for therapeutic purposes. And what are the benefits of water? So when I am inside water, when it's a neck level immersion, you're 90% deloaded. So that is your key towards early rehabilitation. There are no loading forces that are coming onto your joints. It's the compressive forces, it's the force of water that is coming onto the joint that helps you to reduce pain, helps you to reduce edema, and helps you for early repairing in the water. So hence accelerating your functional recovery. At Aquacentric, we have indoor therapeutic, hygienic, warm water pools that we use for the early rehabilitation, and that gives us a faster recovery. Now let's just dive into what this aquatic therapy is. So now improving the range of motion. Range of motion improvement is the primary requisite in order to attain functional goals. Otherwise, certain functions are going to get hampered. So underwater, accelerating range of motion is easier because of the pain-free and less swelling of the structures that is seen across. One of the major goals for your early rehabilitation. Now here you can see a high flow water jet that is used to give a deep tissue release, used to reduce the adhesions that are formed. And that is where again you obtain a good pliability of your muscles. Strengthening in water, again, now here we use the property of viscosity of water. Water offers a good resistance and which can be used to target your specific muscles. So we can use different instruments here. So here now the person is using flippers, and here is a good amount of resistance for your hip and knee muscles, good amount of ankle stability and core that is challenged here. Also, we have underwater elliptical at Aquacentric. And this is, so whenever an athlete undergoes an injury or surgery, there's a good period of immobilization in certain cases. And that is good enough to get your cardiovascular endurance down. However, here we focus that your cardiovascular endurance is again maintained because that is very important later in your performances. So this is your underwater elliptical. Your gait training, that is Walking is the primary need of any human. So now after surgery, because on the land there are a lot of forces that are going to come, especially you're going to load your joints. In water, these forces are eliminated because of buoyancy, and that is where you can start gait trading in very early phase of rehabilitation. You can maintain your walking parameters. Here you can see that there's an underwater treadmill, and you can walk on it, and also at the same time you can see yourself there. So there's a good biofeedback that is provided. This can be done in early phases of rehabilitation because there are no loading forces. Again, this is pain free, reduction of swelling. So to increase the resistance, to challenge it a little more, again we add flippers, and then the person is made to walk. So it again offers resistance. It maintains your closed chain activities. It offers you a good resistance there, increases your range of motion, also maintaining your gait parameters. Plyometrics. So plyometrics involves a lot of jumping movements, a lot of explosive movements. So generating power in your game usually comes from your plyometrics. So doing it a little early on the land can be very challenging because of the loading forces. As I said, in water you can start plyometrics very early. You can maintain the power and explosion of the muscles there. So this is an underwater plyometric station. We have it at different grades at aquacentric, and hence here how you can do plyometrics. You can again, so these are the different color codes for the station. You can give weight in the hand and then do your plyometrics. Now here again, we can start a water turbulence inside it, inside the section, and the person has to work a lot against the water turbulence, at the same time challenging his closed chain. Core muscles, as I said, we emphasized previously how important the core muscles are. So that is how we challenge your core muscles. You get noodles, and here you need a lot of core to sustain this position. Again, as you increase the buoyancy of the object, you increase the force that has been coming, and it's very difficult to take that buoyant object down. Again, challenging your core. So this is your advanced knee and core. This is providing a good resistance here again because of the turbulence of water. And now you will do crunches, that is activation of the core. Apart from that, there's a good activation of your knee musculature. So it's advanced knee and core there. We can target both. So you can use different permutation and combination of your equipments, of your resistances, depending on the condition, depending on the state of the athlete. And water rehabilitation again is a boon because you can get there very quickly. You can do a lot of plyometrics. So here we are increasing the resistance by, we are again challenging the stability in the water. And trust me, challenging your dynamic as well as static balance in water is excellent. The minute you stand in water, your core starts to fire because you need to maintain that verticality. A lot of athletes also undergo emotional stress. So there's something called as WATSU. It is a passive relaxation technique maintained in the aura where your whole body is relaxed and all your parameters are set accordingly. You're mentally relaxed, and it's a complete passive relaxation. With WATSU, you can also mobilize your spine. So this is a cervical mobilization to the spine. Along with that, you can give mobilization to your entire spine there. So you can add now scapular stabilization. Again, very important. You can add a good amount of weight there and challenge your scapula because that's really important for your shoulder rehabilitation. You can again give an instrument here, a buoyant instrument, ask the person to challenge the core, hip stability, ankle stability, and then move the roll up and down. Advanced training, so this is a TheraBand. You can try in different positions and try and mimic the action that you're supposed to do on field. So this is again at aquacentric, how we challenge your core, your hip, ankle stability. So the person is wearing snorkel, is supposed to lie in prone, and then supposed to do the movement from shoulder with more and more object that is buoyant. We can again increase the resistance by wearing your flippers. So high intensity core, again, we challenge the core a lot. The most important segment in all fields. Uh, Again, and trust me, maintaining plank is even difficult as compared to land, because here again you have water to destabilize you. So the person is supposed to challenge his ankle stability, hip stability, at the same time do a good amount of core there, activate scapular stabilizers also. So this is again one of the advanced core techniques that you can see. The person is wearing snorkel, and now we will add dynamic movements. So that kind of mimic the pattern. Now let's have some insight into land therapy. We all know there's a good evidence that is out there about land therapy, and very important to target your muscle endurance. Targeting scapula is very important in assessment. Constant assessment, reassessment. Please have a symbiotic relation with your surgeon. Always keep the person informed, because we manage the person as a team. We need to understand work conditioning. I'll tell you what it is. Emphasize a lot on functional training and return to sports. As I said, your scapula, your shoulder blade is most important muscle, is most important bone, and the muscles surrounding it are most important to provide a check-in mechanism so that your shoulder doesn't go overboard. A good biomechanics and control of this muscle is required in order to prevent your overuse injury. Most important muscle, your serratus anterior, targeting that right from day one, because it's going to keep your scapula really stable on your rib cage. So this is how we challenge the core. A person is made to sit on a dynamic surface. Core is challenged. We can mimic many movements that are there. Again, sitting on a dynamic surface and challenging the core. We have a Pilates reformer. You can use all sorts of resistance and your movements to challenge yourself. Now, do the exercise in the right way. Most important thing I just want to highlight out here is an incorrect squat is a beautiful exercise, but incorrect squat technique is said to be most frequent, causing most frequent injury to your spine. So that has been already proven in the research that most vulnerable is your spine if you do an incorrect squat technique. What I mean by that is, when you're squatting, you should understand that here, there shouldn't be a butt wink. Your tailbone is not supposed to go curved like that. Your back should be straight, chest should be high, and this is the slanting position that should be attained. There should be absolutely no butt wink there. So if you have a good ankle mobility, your good eccentric knee control, there will be no butt wink. Otherwise, that's what is going to happen to you. So what I mean by squat technique is stop where your tailbone is correct in a slant position, chest up. Don't go further down and increase your butt wing. So good squatting technique is important, especially your wicket keepers, because they are required to maintain this sustained position. At Aquacentric, we translate the effects of your rehabilitation into outdoor training. So we have something called a sensory path here. So we make the person walk on different pathways to challenge his proprioception, and then we give an outdoor training of sports specific exercises. So those are the ability drills that he's supposed to do. And here you can see how we kind of try and mimic the requirements. This is everything goes hand in hand. All the phases of healing are respected, and only when we think that now the person is able to do, we give a green signal. So the goals at Aquacentric, so holistic rehabilitation is incorporation of your aquatic, of your land, and of your outdoor training. Three together gives you a good rehabilitation, targeting all your systems. We prefer pain management. We do a good performance assessment and performance enhancement by technique modification. We give a good sports specific rehabilitation, and the effects need to be translated into functional training. Now, what is the key to good rehabilitation? Work conditioning, work hardening. Work conditioning is trying to mimic the sports environment, trying to mimic the manner in which the athlete is supposed to return to sports. Incorporation of all your body system. It's not just your muscles and bone, but your nervous system, cardiovascular system has to be targeted right from the beginning of rehabilitation. As I said, a holistic approach. So at Aquacentric, we have free e-consultations started, and as we all know that if you have any queries or questions and are facing any injury, kindly contact us on the numbers displayed on screen for a free e-consultation. See, the times have changed. There's a lockdown, we understand. And if work can reach home, so can therapy. So tele-rehabilitation has become the new normal now. And availing the service of tele-rehabilitation, your health is a priority. Work reaches home, so can your fitness. So that's all for today. And if you have any questions, you can put it in the comment box. Next Wednesday at 9 a.m., we have Dr. Devashri Vora, who will be addressing about common sports injuries in children. So thank you very much. So this is the time, guys. Train yourself, get your core right, get your scapula right, let your physical therapy reach home as your work does. Thank you very much. Mr. Anubhav Jain?
Yes, Dr. Vaidya.
Hello, sir.
Hi, you can hear me clearly?
Yes, sir, I can hear you clearly. So,
Fantastic.
sir, now that you're into this field and you're a sports enthusiast yourself, so I just wanted an insight about now the aquatic therapy is, it's the new trend that has come, and it's not just entering into the pool. Aquatic therapy is a medical treatment, a medical therapeutic pool that involves a lot of equipments, underwater treadmill. So it's basically therapeutic. It's not just entering the pool. It's giving the right rehabilitation there. So, sir, how much awareness is there, or how much the athletes now are keen towards the use of aquatic therapy, because it has a benefit of early rehabilitation and performance enhancements?
Absolutely, absolutely. So look, I don't quite have a technical expertise here, but at the same time, I know certain examples.
Right.
I'm a big sports enthusiast, cricket enthusiast, football enthusiast. I know that Cristiano Ronaldo, I was watching this YouTube video a few years back, and he was giving a tour of his house. And so he's actually recently built a swimming pool in which there's this. Can you hear me now?
Yes, sir, I can hear you.
Yeah, so he's built this pool which has an underwater treadmill.
Right.
And so he uses it for rest and recovery. I'm not sure if the other players have it, but I'm pretty sure the training centers of the different football clubs, the different cricket teams, the different sports franchises must be having certain facilities at their training centers such that players can actually rest and recover using water as a resource.
Right, sir. Right. Okay. Thank you, sir. So that was great, sir. So any queries from your side that you have that you want?
Yeah, quite a few, as in like 2 or 3. So I was watching the presentation. Firstly, very enlightening. Thank you so much for sharing all your insights and knowledge with us. Certainly was an eye opener for me in so many ways, because I do know these injuries that players incur, but from a very high level. I didn't quite know, the technical workings of all these injuries. What is it that these injuries? What are certain factors that make certain players more prone to injuries? So that was an eye opener for me in many ways. Now I know that you showed examples as well. There were lots of videos, lots of images that you used throughout the presentation. So that was very helpful. But I think I would love to actually use specific examples, maybe 2 or 3 specific examples. Some of them you may know, others you might not know of, but I'm pretty sure you can give us some insights here. So firstly, I'm not sure if you've heard of the Australian fast bowler, Pat Cummins. So so Pat Cummins first burst onto the scene as an 18-year-old. He made his test debut for Australia against South Africa in Johannesburg when he was 18. Played his test match there. For the next 6 years after that first test match, he didn't play a single test. So between 18 and 24, did not play a single test, only because he kept sustaining injury after injury after injury after injury. And so, although he had a lot of talent, although lots of these legends of Australian cricket touted him as being like the next superstar, somehow he kept getting these setbacks because of injuries, right? But at 24, what happened? And of course, this probably wasn't overnight. This happened in the 2 or 3 years leading up to 24. At 24, he started feeling as if his bones became denser, became stronger. In fact, in the Australian cricket camp, there's this joke that they call their 24th birthday, the bone healing day or the magical day on which your
Right.
bones heal. And so, can you talk to us a bit about that? Because, of course, nowadays you have 16-year-olds, 17-year-olds, 18-year-olds who begin their careers playing football, high-intensity football, professional cricket, right? But I'm guessing their bones haven't quite matured at that age. So, is it only around, say, 23, 24 when your bones start to mature, and that's what makes you less susceptible to injuries, especially impact injuries?
Yeah. So talking about impact injuries, correct. So ideally till age of 25, see there's something called as loading forces. So loading forces, if they are put on the bone, if the bone is loaded, there's a good amount of remodeling of the bones that takes place. That is generation of new bones, and that should happen right during when there's time for puberty. It's not something that will happen afterwards. So loading forces, basically there should be a good amount of emphasis given to training of loading that is done in young children, especially your recreational athletes. So that should happen during puberty, and afterwards it's just the maintenance work basically. So during puberty, the maximum load that you put on the joint, there is a good amount of growth generation. Also your end place is something called as end plate over the bone. So your bones grow taller, your bones grow stronger. So that should be targeted during your puberty. After puberty, it's usually the maintenance. So if you want to avoid a traumatic injury, because that's going to be sudden, you don't know how it's going to happen all of a sudden. So that's when you need to target in puberty a good amount of loading exercise. So children, ACSM, that is American guidelines for your exercise, also mention this, that children and adolescents, be it recreational or be it professional, should be targeted to a good amount of loading exercise. That will happen only during puberty. Later, it's maintenance. And female athletes after 30s should focus more on that, because female athletes are more prone towards your bone resorption, that is your bone eroding. So especially in female athletes afterwards. So denser bone, especially in puberty. So you lay down the foundation and you maintain it later.
Understood. That makes sense. But at the same time, I'm guessing, and I might be wrong here, say during puberty, say maybe when you're 15, 16, right, for males, that's when you said you have to go through this loading process. So I'm guessing what the loading does is, in the future, it makes your bones like stronger and denser, such that you don't quite feel the full force of it. Or perhaps your bones have become robust enough that the force doesn't hurt you as much, right? But do you still have to maintain somewhat of a balance, because it's 16 and 17, right? You're still somewhat fragile. You still haven't completely grown. And so too much loading can also be very detrimental.
Yes, I agree to that. It has to be maintained. It has to be sustained. So the forces have to be sustained. And that has to be really careful. That needs to be done there.
Makes sense. Lovely. Then, and let me know whenever you're running out of time. So I
Sir.
still.
So I think we are running out of time. So
Okay.
thank you, sir.
Thank you.
Thank you so much.
Thank you so much.